Hello, everyone. I'm Mary Beth Marsden, and welcome to GBMC's Greater Living, where we bring you conversations about your health and about living better lives once a month. And we're live, and we'll take your questions on Facebook. So it's an exciting half hour, and we're glad you're here with us. We are hoping in the next half hour to put you to sleep. Not right now, but tonight, hopefully, because a lot of people struggle with their sleep. It's a huge issue, and I mean, heavens knows we've lost sleep over this pandemic in the last year, right? Just worrying about it. So joining us now to talk more about healthy sleep habits and what that actually means is Dr. Raya Wehbeh, a sleep medicine physician with GBMC Health Partners Sleep Medicine. Dr. Wehbeh, thank you so much for being with us.
Thank you for having me.
I hope you're joining us after a good night's sleep.
Yes, I do like my sleep.
You practice what you preach, right?
I try.
So this is a huge issue, and there's so many different areas we could talk about because it affects children, it affects teenagers greatly, I think, and adults, all stages of life, and the issues of sleep seem to change too as we age. So let's just start broadly and talk about, when we're talking about healthy sleep habits, what do we mean?
So healthy sleep means to get a good quantity of sleep, a good amount of sleep, and a good quality of sleep. That's what broadly healthy sleep means.
How would you define that? I guess you would define that by hours, right?
So the amount of sleep, yes, is defined by hours. And usually the American Academy of Sleep Medicine recommends that adults get about 7 to 8 hours of sleep each night on average. So, and actually some reports tell us that there's about a third of American adults who don't get enough sleep. So it's very important to make a point of getting enough sleep at night.
Yeah, it seems like the most natural thing in the world, right? That anyone can do it, and so many people continue to really struggle with it. So 7 or 8 hours of sleep in general is what we're talking about for most adults. And I think it's a little bit more for teenagers, right?
Correct. Yeah, teenagers, depending on their age, but they usually need a little bit more, 9 to 10 hours, I would say.
And when we're talking about the hours of sleep, is it better always to have sleep at night?
So when we're talking about the amount of hours per sleep, it doesn't necessarily mean you have to sleep at night. But naturally, sleep at night becomes is a little bit easier than sleeping during the day. And shift workers, definitely people who work at night and have to go to sleep during the day, might find it a little bit more difficult, because then one of the very simple things is life goes on during the day, and the other thing is light is one of the most powerful cues that tell our body wake up. So there is a little bit of dysregulation in the clock that we have, the biological clock that we all have in our brains, and it needs reprogramming when you want to sleep during the day. But the best sleep would probably come naturally during the night.
So why do so many people struggle with this issue of sleep?
So there are many reasons why people could struggle with sleep. So sometimes people don't get enough sleep just out of habit, because they just don't make it a point to go to bed early enough or to wake up assuring that they have the adequate amount of sleep. But otherwise, sometimes there could be some issues going on that could cause the lack of sleep. So for example, it can start with simply the environment. The room is too cold or too hot, so that causes sleep interruptions. Sometimes it could be a medical condition, such as conditions that could cause pain, or heart problems or breathing problems that could cause shortness of breath or interruption of sleep that way. It could be some psychological problems such as depression or anxiety, which could interfere with the quality of sleep as well. And also it could be some sleep disorder that is interfering with sleep. And there are many sleep disorders that could interfere with sleep, such as sleep apnea, restless leg syndrome, insomnia, narcolepsy. So there's an array of things that could interrupt sleep. And usually we have to look at the person as a whole and see what is it out of these reasons that is interrupting the sleep.
Which leads me to ask, how do you do that? When somebody comes to you and says, Dr. Wehbeh, I can't sleep. Here are some of my issues. Here's what I've tried. Nothing's working. I can't fall asleep. I can't stay asleep. How do you go about diagnosing and figuring out this puzzle?
So the most important thing is to get a very good history or a very good description from the person of how do their sleep look like. And that will give us clues to go down the list that I just mentioned to find out what is it that is most likely causing the sleep disturbance. And preferably we start by treating the cause. So if there is an identifiable cause for why the person isn't able to sleep well, then we try to treat the cause. And then if we suspect a sleep disorder, then there's also some workup that we can do. So for example, if we are suspecting sleep apnea, which I mentioned because it's one of the most common sleep disorders that we see, and it's very often unrecognized because the symptoms aren't always known to suggest that there's sleep apnea. So and for example, to figure that out, we do a sleep study, which could be done at home or in the sleep lab. But there is the taking the history and the story from the patient is the most important thing.
Let's talk about the sleep study. We've heard about sleep studies. I don't know if everyone really realizes what that involves and how do you do it at home, and do you have to hook electrodes to your head? I mean, how do you go about diagnosing sleep apnea?
So there's two types of sleep studies. One is the sleep study that we do in the sleep lab, and that involves coming and spending a night in the sleep lab, and the person gets connected to wires from head to toe, and we watch the breathing patterns along with the brain waves, along with the movements in the arms and legs to find out certain things about their sleep and to find out if, for example, the breathing is compromised in a way that would suggest sleep apnea or not. The other type of sleep studies is what we call home sleep testing. Home sleep testing is basically a device, and there are multiple types of these devices on the market, but it's usually much more limited in terms of what data we can see in it, but it's also easier to apply, and usually it comes with instructions and the person would apply it to themselves and sleep with it overnight, and then it comes out with a report that with data that we can download, and then we can find out if the person has a sleep disorder. And these are particularly important for sleep apnea diagnosis, much more than anything else, because the information that they give us are much more limited than the study in the lab. But of course, they are also much more convenient.
Yes, I would imagine there are people who come to the lab and say to you, I'm never going to fall asleep with all these wires and everything. Do they end up falling asleep anyway? I mean,
most people do.
Okay.
And you're right. It's a very, very common question I get, but most people do. Some people, believe it or not, might sleep better because some people just find it hard because they're psychologically used to having insomnia in their bed, so they end up sleeping better. Of course, we do get occasionally, every once in a while, a sleep study where the person wasn't able to fall asleep, but that's much, much, much more rare.
Sleep apnea. We've all heard the term. Does it mean that you stop breathing? How do you define what that is?
So it's exactly that. It's basically stopping breathing at night. It could also be if the breathing is getting shallower, so you're not getting a full breath. And the way that happens is when we all fall asleep, the muscles of the body tend to relax. The back of the throat, particularly, there are a lot of muscles, including the tongue, the roof of the mouth, the back wall of the throat. And some people, by anatomy, these structures are close to each other. So if, as part of the muscle relaxation in the body, they relax at night and they end up getting either too close to each other or touching and overlap and relax in that position, they can create a block in the airway or even a narrowing in the airway that prevents the air while you're breathing to fully get in. Subsequently, there is a response from the brain to send some hormones to wake the body up. And so that can happen multiple times a night. And that's also, of course, good. But what ends up happening is that the sleep gets interrupted and the sleep quality becomes more poor. And that can result in some people feeling tired and sleepy the next day, because even though they have slept enough, they didn't get a good quality of sleep.
And can you avoid it sometimes by the way you sleep, if you sleep on your side or you sleep on your back?
Sometimes, yes. So there is, that's not always, but there is what we call positional sleep apnea. And that means that in certain positions, commonly when the person is sleeping on their back, the sleep apnea can get worse. And it gets better if they turn to their side. And that is something that could happen. And in this case, we recommend something we call positional therapy, especially if we're dealing with milder degrees of sleep apnea, which means that we help the patient find ways to avoid sleeping on their back. It's a little bit subjective in terms of response, but it's definitely something that can happen.
Is snoring often a sign of sleep apnea?
Very often.
So
Yes.
I would imagine that a lot of people come to you not because they've noticed an issue, but their sleep partner has noticed an issue.
Many times, many times. Yeah, and snoring is a very common sign for sleep apnea. It doesn't always mean that you have sleep apnea. There is something we call primary snoring, and that basically is snoring that was found not to be associated with sleep apnea. But I'm going to say some reports say up to 90% of snoring is associated with some degree of sleep apnea. Some reports say about 75%. So there's a good portion of people who snore who end up having some degree of sleep apnea. So usually the best way to kind of look at it is to look for other signs and symptoms for sleep apnea, such as is the sleep getting interruptions at night? Are you waking up to go to the bathroom often at night? That's also a sign of sleep apnea. Are you sleepy during the day? Do you wake up feeling unrefreshed or feeling like you haven't slept? These are all signs that could point towards more possibility of sleep apnea than just isolated snoring.
Now, what are the other causes of snoring? You mentioned it's highly likely that it may be sleep apnea, but it could be other things as well.
Yeah, so snoring is the sound of the vibration in the back of the throat when you're trying forcefully to get air in. So snoring does suggest some degree of upper airway resistance, which in a way is actually a milder degree of sleep apnea, but it didn't meet the criteria to be called sleep apnea, because to be called sleep apnea, there has to be stopping breathing or shallow breathing in a certain amount. Now, sometimes nasal allergies, nasal congestion, especially if you're having difficulty breathing through the nose, you're trying to help out by breathing through the mouth forcefully, and that can create the back of the throat to vibrate more violently and create the sound of snoring. So sometimes these type of things can also make a person more subject to snoring, especially if we don't find sleep apnea as part of it.
So if you do meet the criteria of sleep apnea, are you always going to have to wear one of those machines at night?
Not always. So the machine you're referring to is called a CPAP machine, and it is the most commonly used because it's the most effective way to treat sleep apnea in any degree. So very commonly we recommend it. But there are some other treatment options that we usually discuss once the diagnosis of sleep apnea has been established. And one of them is what we call an oral appliance therapy, and that's a mouthpiece that's made by a dentist accustomed for the patient, and it's adjustable. So what they try to do with it is they try to adjust it to bring the lower jaw forward to open the space in the back for the air to get in. Now, this is recommended if the sleep apnea is in a mild to moderate degree and could be considered. Success rate is still a little bit less than CPAP, but it's something that could be tried if the person absolutely doesn't want to start CPAP therapy. For severe degrees, yes, we very often recommend CPAP therapy. There are some surgical options for sleep apnea, but we have been shying away from the upper airway surgery just because over the years we have found out that it actually isn't as effective as people hoped for. So a lot of times people have the surgery on the back of the throat, and clearly it's invasive and it's very painful, and they might have to end up using a CPAP machine anyway. So talking broadly, CPAP is the most recommended treatment for sleep apnea. Of course, the other thing I would like to mention very strongly here is weight loss. If you are overweight, then weight loss is something that could be an ultimate treatment for sleep apnea, of course, depending on the degree of weight loss and the degree of sleep apnea, but it's something that can help and we always recommend. Now, that doesn't mean that if you are of a normal, healthy weight, you can't have sleep apnea, because there are some other factors involved, like the anatomy of the face and the back of the throat. But if you are overweight, losing weight is one of the things that we invariably recommend in this case as
I would
well.
imagine there could be a lot of lifestyle changes you could make in conjunction with your sleep apnea, even like when you eat, a time of night and so forth. What is it like if you're thinking about getting, or you think you may have to get a CPAP machine? I imagine that people who get it see a difference and they're happy that they're getting sleep finally. They realize what they've been missing by how good they feel now after getting a full night's sleep. What is it like for the partner who doesn't have sleep apnea with a partner who has a machine going at night? Have they gotten quieter? Do people get used to it? How does that work?
So sound-wise, they've become much, much quieter. Partners are usually very happy because very commonly the sound of the machine it's almost like white noise. So it's really, really almost unnoticeable, and it's usually partners are happy because the snoring completely goes away when you use a CPAP machine. So yeah, in terms of getting used to it, yes, it's an adjustment, of course. The CPAP machines have come long way. So most people think about them as a big mask that goes over the face, which could be, but that's not necessarily what you need to use. So some of these masks have become much smaller. Some of them cover the nose, some of them just come under the nose, some of them have pillows that go in the nostrils. They even have now variations of interfaces or masks that have the hose come from the top of the head, so the person doesn't even see the mask when they're wearing it. There are many that allow people who wear glasses to have them on and read. Again, they've become quieter. They have had a lot of technology go into them in terms of how to make them more comfortable, to avoid some of the things that we used to see a lot in the past, like a dry mouth, for example. There are adjustable humidities. There are adjustable temperatures of the hose. There are many, many things that could be done to make it more comfortable. I always say it is still an adjustment, but it's one of those things that the more you use, the more you get used to it until it many times becomes second nature. And many people are actually very pleasantly surprised because they feel the difference, as you said, in the quality of their sleep and in how more energetic and more alert, and even with concentration and attention during the day. So a lot of times people are happy once they have gotten used to the machine.
I imagine the best part of your job is when someone comes to you and says, "Oh my gosh, you've changed my life completely. I had no idea how much better I could feel, and why did I wait so long?"
Very often I hear that, and it's very, very rewarding. It's one of the things why we do this.
What are some of the serious complications of untreated sleep disorders, maybe particularly sleep apnea? I mean, it really can lead to some serious things, right? Side effects.
It can, yeah. So we think that untreated sleep apnea can lead to multiple health issues, including high blood pressure. If you have diabetes, it can get more difficult to control. It can lead to irregular heart rhythms, even heart attacks and strokes. So yes, we do think that if untreated, especially in significant degrees, it can lead to health issues involving the heart health particularly.
Okay, let's just talk about, let's say you don't have sleep apnea, but you're generally having a hard time either falling asleep or staying asleep. And I know you have to go through diagnostic criteria and figure out what could be the culprit. But what are some of the really common problems that people are not dealing with, whether it's being on their phones right before they go to sleep? This is a huge issue. Is the blue light still really affecting sleep? Is that believed to be still a factor here? What are some of the common things that we should be doing? Keeping a schedule, all of those things.
Sure. So So this goes under what we call healthy sleep habits. And these are good habits to have, whether you have a problem with sleep or you don't have a problem with falling asleep or staying asleep. But particularly also if you have a problem, there are many things we can recommend. Some of them could be particular a little bit to the person, and we can recommend something and tailor it a little bit more specific to them. But as a general rule, what we very often recommend is to stick to a regular sleep-wake schedule. What that does is that it signals your brain and your body that this time of the day is allotted for sleep. So it helps the brain to give the body the signal to shut down when it's sleep time and to wake up and be more alert when it's wake up time. So sticking to that schedule, as I mentioned before, there's the biological clock in the brain, and if the clock is programmed that way, it can help with the falling asleep and even with the waking up process in the morning. One of the other things that we recommend very often is to establish a bedtime routine or ritual. So what that means is it's a sequence of things that you do every night in the same order before you go to bed to help the brain and the body anticipate sleep as the next step. So as an example, some people choose, and everybody can come with their own, but as an example, some people choose to start with a warm shower, followed by drinking a cup of milk or a cup of decaf tea, followed by reading, and then followed by going to bed. So if you do that in the same order every night, it helps the body. Once the warm shower starts, oh, next comes the milk, next comes the reading, next must be sleep. So it helps the body go down into the sleeping mode and helps the falling asleep better. This is one of my favorite tips that I like to give because I think that it's very, very effective.
Yeah, I mean, it sounds
One
so
other
old-fashioned, but it actually works. I mean, sometimes the simplest thing can make the difference.
It is very simple, and you can't imagine how many people don't think of it. Now, of course, some people have their rituals of brushing their teeth, but they don't think of, doing it in the same order. And that particularly is helpful if you're having a problem falling asleep, especially. Um, One of the things that we always like to recommend as well is to use the bed only for sleeping. This is particularly important in these days because with this pandemic, more people are working from home, spending more time at home, and they tend to sometimes maybe do their work from their bed or in their bed. They tend to snack in bed, eat or drink, respond to their emails, do all kinds of other activities than sleep in bed. The problem with that is that it gives the brain and the body a mixed message. So if you only use your bed for sleep, once it's bedtime and the body hits the bed, your brain is like, oh, okay, I'm in bed. That means I'm supposed to sleep. But if you're doing all these other things in bed as well, then you hit the bed and your brain is thinking, am I supposed to be working, eating, or sleeping? So there's this mixed message that causes a little bit of confusion and probably doesn't help very much with the initiation of sleep as quickly as if the bed is triggering the sleep act. So what we usually recommend is if you were to try to use the bed only for sleep, and if you were to do other activities, it's preferable to do them outside the bed and preferably outside the bedroom if possible, of course.
Someone,
Now,
someone has written
go
to
ahead.
us on Facebook about apps, apps on your phone that are supposed to support your sleep. And they said, I use my fitness tracker to track my sleep. Is it an accurate measure of my sleep? Do you think this is helpful?
So this is a very good question, and we have been, of course, lately getting this a lot with the emergence of all these fitness trackers and all these brands. Um, so there has been recent studies that looked at some of these tracker brands and compared them with the sleep studies that were done in the laboratory setting. And what they found is interesting in the way that each of these trackers was better than others in certain parameters, but not the other. But the conclusion, the broad conclusion, was that these trackers do a reasonably good job with distinguishing sleep from wakefulness. They don't do as good of a job in finding sleep stages. So, for example, if your tracker tells you you slept 6 hours a night or you woke up 3 times a night, this might be a little bit more reliable than if it tells you you didn't get enough REM sleep or deep sleep last night. So that's where we are with the current technology. Of course, these are things that are forever changing, and we'll see what comes up in the future.
Is the REM sleep, the deep sleep, the most important sleep?
All sleep stages are important. So sleep consists of multiple sleep stages. Of course, there's the stage of drowsiness, or what we call stage 1, and then there is stage 2. What we traditionally call deep sleep is what we call in professional terms stage 3, and then REM sleep is a stage that so the term REM is rapid eye movements, and it's sort of a more active stage of sleep, and it's where we dream most commonly. There is a little bit of dreaming that happens in other stages, but it's where we dream most commonly. And so that cycle of stage 1, 2, 3 REM, stage 1, 2, 3 REM repeats throughout the night, and all these stages are important, and there are some variations in these stages depending on certain situations. Some medications may alter it, some the age, of course. With age, we can see a little bit more, variations in the proportion of these stages towards sleep. But there is no one stage that's more important than others.
Is there a magic number as to how many times you should cycle? Do you know what I'm saying?
I don't think
Through the
there
stages?
is a magic number,
Okay.
but normally I would say 3 to 4 times is what most people cycle in a healthy sleep cycle.
So coincidentally, or maybe it was planned, we're doing this interview just a few days before daylight saving time hits us again, and we spring forward. So we lose an hour of sleep, so to speak. How do you get calls after this happens? I mean, for some people, this is a huge adjustment.
Yeah, the best way to adjust to it is to adjust the sleep schedule gradually. That's what I would say. If you are one of those people who this affects them, I mean, in my experience, I think that people adjust to it fairly quickly as it happens, because you'll have to go to work and start your day, and gradually your sleep will adjust according to that. But if you're one of those people who really have trouble, then you would want to kind of adjust your sleep-wake schedule gradually in anticipation for that time.
This question is for all the parents who have teenagers and possibly young adults who are still living at home because of the pandemic, and they've got a house full, and they're watching these young people have these terrible, terrible, terrible sleep habits, and it's making the parents crazy. Can you tell I'm speaking personally? So this is a huge problem for this generation who have the computers and who maybe are taking classes that they can go anytime and are becoming completely nocturnal.
That's true. So we do think that teenagers, there's a lot more thought about this actually within recent years, that we think that the circadian rhythm of teenagers, actually the biological clock gives them the signals to be a little bit more awake later in the day, and that they would need subsequently to sleep longer a little bit in the morning. So there has been, of course, this talk about whether school times, this was all before the pandemic and before we became all virtual, but there was this talk about should school times for middle schoolers and high schoolers be a little bit later, and all these type of things. So we do think that there is a little bit of that part of the biology that happens with the changes during the teenage years. But I am with you completely that the pandemic didn't help. The fact that they have their screens with them during the night is probably not helping either. Here's what screens do. I mean, first of all, you mentioned the light, and light is one of the things, I mentioned that before, it's one of the most powerful cues to help the body realize that it is awake time, not sleep time. So having the screen in there is probably not helping. What they are doing or watching is probably also alerting, so it's not necessarily helping with sleep. And the other thing that we want to keep in mind is that these teenagers are sitting in bed and on their screens all the time. So they're also doing something other than sleep in bed. So that not necessarily is helping either. So it's a problem. If we want to talk, ideally, there need to be a certain time in the night where you would tell your teenager, we're done with screens, and this is the time that screens come out of the room, and this is the time that we want to wind down and go to sleep. Does that
Yeah,
always work?
right.
No, but this is definitely what I'll tell you when that becomes a problem. It becomes more of a problem when the virtual learning stops and the biological clock of these teenagers or young adults, I see that in college too, and these teenagers and young adults, the biological clock has been reprogrammed to be later, to fall asleep later in the night and wake up during later in the day, which is possible when you're doing things virtually, because you can literally wake up 5 minutes before your class and just be in your class in 5 minutes. When the school comes back or when you have to go to work, and life goes back to a little bit more of a normal pattern, this is where we start seeing this problem, and this is what we call delayed sleep phase disorder, and there are things that we can do to bring it back. And of course, one of the things that I always recommend in these cases is that the screens have to come out of the room at a certain time, maybe a little bit easier at that point in time when there is something that they actually have to get up to do at a certain time, but they can't do it because this is how their biological clock is programmed at this point.
Well, Dr. Raya Wehbeh, thank you so much. It's such great information. It's just a big, important issue for all of us. And after speaking with you, I hope that there are a lot of people watching, and myself included, who have a great night's sleep tonight, and we'll think a little bit more about making that more of a priority. So thank you for being with us today on Greater Living.
Thank you for having me.
And thank you all for joining us. We'll see you next time.